Hello everyone, today I will make your concept clear on the urinary bladder tumor. Okay, so we will talk about the most frequently asked question for this topic. Okay, so starting from the urinary bladder tumor. Okay, so the tumor of the urinary bladder, they most commonly arises from the epithelial tissue. Okay, so the lining epithelium of the urinary bladder is transitional epithelium. So the most common urinary bladder tumor is transitional cell carcinoma. Okay, and this is also known as urothelial tumor because transitional cell or transitional epithelium is also known as urothelium, so it is also known as urothelial tumor. And next, some important high points that is recently and repeatedly asked in the NEET Pg in trans. Okay, so you have to remember these points, like most common benign tumor of the urinary bladder of the mesenchymal origin. Mesenchymal means connective tissue. Okay, fat as well as muscles. Okay, that is leiomyoma means benign tumor of the smooth muscle. And next, most common sarcoma of the urinary bladder in the infant and children. So sarcoma means it is a malignant tumor of mesenchymal origin. So it is embryonal rhabdomyosarcoma. Okay. Now similarly, most common sarcoma of the urinary bladder in the adult. In the infant it is embryonal rhabdomyosarcoma, whereas in the adult it is leiomyosarcoma. Okay, leiomyosarcoma. Okay, these are some important high yield points. Now, what are the risk factor of the urinary bladder cancer? And this is also repeatedly asked. Okay, the highlighted points, they are very important. We have to mug up. So based on the different type of the urinary bladder cancer, like from the transitional cell carcinoma. Okay, so from the transitional epithelium there will be transitional cell carcinoma. Similarly, if there is metaplasia, okay, due to continuous and prolonged irritation of the urinary bladder, the epithelium of the urinary bladder changes into the squamous cell. Okay, so for protection it changes. So if the tumor develop, it will lead to squamous cell carcinoma. And similarly, if the metaplasia, there is intestinal metaplasia, means there is presence of the glandular epithelium cells, okay, columnar cells, okay, with the goblet cells in the urinary bladder, the cancer will develop as adenocarcinoma, okay, related to the glands. Now transitional cell carcinoma. Okay, there is a high chance of developing transitional cell carcinoma in person who is fond of cigarette. Okay, cigarette smoking is most important risk factor. Okay, so the most important risk factor in the transitional cell carcinoma of the urinary bladder is cigarette smoking, and others like exposure to the aryl amines. Okay, aryl amines like 2-naphthylamine, benzidine, aniline. Okay, and these aryl amines, they are mostly found in the leather workers as well as dye workers. Okay, textile workers. Okay, so these workers, they are more exposed to the aryl amines. Okay, pelvic irradiation for the pelvic cancer. Okay, so for the treatment of the pelvic cancer, if there is pelvic irradiation, there is, it also increases the risk of transitional cell carcinoma. Now exposure to the cyclophosphamide. Okay, it is a drug. If the person has been exposed to cyclophosphamide for long duration of time, there is high chance. Okay, now exposure to the analgesic. Okay, for as a painkiller, if you are eating more and more drugs and analgesics, there is high chance of development of transitional cell carcinoma. Okay, now squamous cell carcinoma. So if there is infection of cystosoma hematobium, okay, so there is a high chance. Next, chronic bladder infection and irradiation. Okay, continuous infection, long-term infection of the urinary bladder, it can also lead to squamous cell carcinoma. Now diverticula in the bladder means blown out pouching of the wall of the bladder. Okay, so it will also lead to squamous cell carcinoma. Okay, so this is important. These are the most important. Okay, this is also important and this is also important. Okay, these are asked questions. Now next, adenocarcinoma. Okay, so it arises from the urachal remnant. Okay, embryological part, this urachal cyst. Okay, so urachal remnant, they can lead to adenocarcinoma if they are remain there. Okay, now intestinal metaplasia, it also increases the risk of adenocarcinoma. Okay, means to occur cancer, not only the risk factor are responsible. Along with the risk factor, the most important factors are the genetic mutation. Okay, so along with the genetic mutation, if the person has some genetic alteration and he is exposed to the risk factor, then there is a very high chance that the person is likely to suffer from the cancer. Okay, now the most common genetic alteration found in the urinary bladder tumor, they are mostly the 9p chromosome, 9q chromosome and 17p chromosome. Okay, p means short arm of a chromosome and q means long arm of a chromosome, and a chromosome possesses the different genes. Like these 9p in 9p, 9q and 17p chromosome, they have tumor suppressor genes. Okay, and when these chromosomes they are deleted, tumor suppressor genes they are also deleted, so there will be no any agent to suppress the rapidly multiplying cells in our body, so there will be increased multiplication of the cells, so lead to cancer. Now this 9p and 9q chromosome, if they are deleted, they will lead to superficial papillary tumor. Okay, superficial papillary tumor means toward the lumen of the urinary bladder, these cells they will multiply in the form of papilla, finger like projection. Okay, now if there is deletion of the 17p chromosome, it contains tumor suppressor gene, that is p53 gene, and if the p53 gene is deleted, it will lead to invasive urothelial cancer, means it is protruding toward the wall of the urinary bladder. Okay, invasion of the wall of the bladder opposite to the lumen. So we have to understood what are the different pattern of the growth of the urinary bladder tumor. Like first we have papilloma papillary carcinoma. Okay, papilloma papillary carcinoma means, papilloma means it is in the form of finger like projection. Okay, toward the lumen, you can see toward the lumen there is finger like projection. Along with that, if there is presence of both, invasion means toward the wall, it is growing toward the wall, as well as it is giving the finger like projection, so it is called as papillary invasive carcinoma. So there is invasion as well as there is finger like projection into the lumen, so invasive papillary carcinoma. Next, there can be flat non-invasive carcinoma, that is it is only carcinoma in situ, means there is no any invasion of the basement membrane, the tumor is growing toward the length of the epithelium and neither there is finger like projection, only it is multiplying the cells within the basement membrane. Okay, so it is known as flat non-invasive carcinoma, carcinoma in situ. And next, it can be flat invasive carcinoma, means there is invasion toward the wall. Okay, and no any finger projection, so it is called as flat invasive carcinoma. So we should know the normal epithelium, how the normal transitional epithelium looks. Okay, so this transitional epithelium, it is a multi-layered epithelium, it consists of multi-layered cells. Okay, now this transitional epithelium, the basal cells, these are usually columnar cells. Okay, these basal cells, these are usually columnar cells. Okay, and above these basal cells there might be 2 to 3 layer of the intermediate cells. Okay, intermediate cells, these are polygonal type of cells. Okay, and above the polygonal layers there is umbrella shaped cells. Okay, and when the cell mature, these cells they will move toward the surface. Okay, so this is means there is intact basal polarity, means the cells are moving toward the surface when they get matured. Okay, now the wall of the urinary bladder. Okay, so wall of the urinary bladder, first there is epithelial layer. Okay, first there will be the epithelial layer, then there is lamina propria. Okay, this is lamina propria. After that there is muscularis mucosae. Okay, these are the muscularis mucosa. Okay, after that there will be muscle layer. Okay, in the muscle layer you can see longitudinal layer, circular layer. Okay, these are the muscle layer. Okay, now there is opposite in the GIT. You can see the inner will be the circular layer and outer will be the longitudinal layer, but in the urinary bladder inner layer will be the longitudinal muscle layer, whereas outer layer will be the circular layer. Okay, now there will be the outermost layer serosa, made up of fat and other tissue. Now when there is tumor, okay, it is a malignant tumor. Okay, so the different feature of the malignancy can be seen. Mostly you can see the cellular atypia. Okay, cellular atypia. Okay, in the normal figure you can see the cells, they are moving from the base to the surface. There is intact basal polarity, but in the case of this transitional cell carcinoma, what is happening, there will be urothelial cells which shows the marked nuclear polymorphism. Okay, the nucleus of the cells, there will be increased chromatin level. Okay, and there will be increased in the size of the nucleus, and the shape of the nucleus is totally different with each other. Okay, so there will be increase in the nuclear by cytoplasmic ratio. Okay, cytoplasm level get decreased, whereas nucleus size is increased, and the cells, they are not moving from the base to the apex. Okay, they are in a haphazard way, so there is loss of the basal polarity. And you can see the feature of the cellular atypia, like there is loss of the nuclear polarity, means the cells, they do not mature toward the surface into the umbrella cells with the low nuclear by cytoplasmic ratio. These umbrella cells, they have low nuclear by cytoplasmic ratio, but when there is this carcinoma, there will be increase in the nuclear by cytoplasmic ratio, and many cells, they exhibit large irregular hyperchromatic nucleus. Next, we have to know the clinical feature of the urinary bladder tumor. So the patient who is suffering from urinary bladder tumor, he or she will present with painless hematuria. Okay, there will be blood in the urine and there will be no any pain during the urination. Okay, it is the most common symptom. Okay, most common symptom in the urinary bladder tumor. And there will be irritable bladder. Okay, irritable bladder means there is some problem with the urinary bladder, means the normal function of the urinary bladder is not present. Okay, it will be lost, like there will be increased in the urgency, increase in the urge for micturition, increased frequency of the urination, and also there will be pain during the urination, dysuria. And another feature, they are very rarely seen features in the patient, like hydronephrosis, pyelonephritis can also be present. And what are the prognostic marker? We have to know the what is the stage of the tumor. Okay, so we have to first take the biopsy, and after biopsy we have to see in the microscope about the grade of the tumor. Okay, and whether there is presence of the invasion, okay, or not, so that it will tell also about the grade of the cancer. So the grade of the tumor, presence of the lamina propria invasion, as well as carcinoma in situ, these are the major prognostic factor. Okay, now if the patient present with invasion of the muscularis mucosa, means there is invasion of the detrusor muscle of the urinary bladder, then this is the worst prognosis. The patient has a less chance to survive. Okay, so 99% patient die if there is presence of invasion to the detrusor muscle. Okay, now you can see the invasion. Okay, here, now this is up to the what, this is up to the epithelium, this is up to the basement membrane. Okay, this is up to the basement membrane, but you can see the seat of the tumor cells that are present in the lamina propria, and even this is your muscularis mucosae, and this muscularis mucosae is invaded. Here also there is presence of seat of the tumor cells, so they have invaded the detrusor muscle, they have invaded the muscularis mucosa, so there is worst prognosis, such patient won't survive. Okay, this is the invasive carcinoma of the urinary bladder. How to diagnose the patient suffering from the urinary bladder tumor? So what are the investigation? The best investigation, if you suspect the patient with painless hematuria, irritable bladder, hydronephrosis, pyelonephritis, okay, then you have to suspect your investigation. and the best investigation is cytoscopy as well as biopsy. Okay, biopsy and cytoscopy is the best investigation. Okay, and other investigation you can also do side by side, like urine examination of the urine markers, whether the urine markers are elevated or not. Okay, the different enzymes they fall under the urine markers, and if the patient has been diagnosed, now how to manage the urinary bladder tumor. Okay, how to treat that patient. Okay, so the treatment is based upon what type of patient comes to you. Okay, what is the grade or what is the stage of the tumor. So based upon that we have to do the treatment, like the patient. So there can be three category of the patient that may have the urinary bladder tumor. Category 1 patient, they have carcinoma in situ, means there is no invasion of the basement membrane, or there is only the invasion to the lamina propria. Up to the lamina propria there is invasion. So for that patient we have to do the intravesical BCG vaccination, means directly through the injection we have to inject the BCG vaccine, okay, in the urinary bladder. So this way we can treat such patient. Now category 2 patient, there is a reoccurring cases of the CIS, means carcinoma in situ, even after the BCG vaccination. Okay, you have given the BCG vaccination but still the tumor is reoccurring. Okay, there is a reoccurrence of the tumor. So, or if the patient, there is carcinoma in situ is spreading up to or down to the prostatic urethra, it has spread up to the prostatic urethra. There is a flat non-invasive carcinoma, but that is spreading up to the prostatic urethra. The lining epithelium from the urinary bladder, it has reached up to the prostatic urethra, or there is muscularis mucosa invasion or detrus or muscle invasion, means in such a case we have to do radial cystectomy. Okay, it is a surgical procedure to remove the tumor as well as the associated tissues to the tumor. Okay, so this way we can treat such case. Now category 3 patient, that is an advanced bladder tumor. Okay, so for case of advanced bladder tumor we have to do the chemotherapy, and in the chemotherapy we can prescribe mitomycin and thiotepa. So this is all about the urinary bladder tumor. I think I have cleared your concept on this topic. Okay, you can get the note from the link in the description. Okay, so if you have liked the video, then please subscribe the channel and share among your friends. Thank you.